Chandray Rheumatology and Immunology Center and Research, a center with a difference. Patient awareness talk by our experts in the field of rheumatology, clinical immunology, allergy and reproductive immunology.
Hello everyone. I think today we are going to discuss about an entity called fibromyalgia. Fibromyalgia is a disease which we get often confused because it produces a lot of pain, a lot of aches and a lot of disabilities. And when you examine the patient or when you see the patients, we don't see anything to visibly any signs or any problems on the examination, and even sometimes the tests also comes negative. And adding to that, this is one of the commonest problem we see in middle-age group, somewhere between 20 to 40 years, which is supposed to be the highly productive age group, where most of us, we should have spent 20 years in training ourselves to become better, and we start earning or working at that 20 to 40 years. When these painful syndromes start troubling us, really the productivity starts coming down. So that being the case, I think it's better all of us to know what it is and how to grow over it and how to work with it. To discuss about that, we have along with me Dr. Praveen. He's a rheumatologist at Chandray Rheumatology Immunology Center. Rajeshwari, who is our psychologist, who is going to discuss about the psychological perspectives. To carry forward the discussion, I think my first query is with Dr. Praveen. See, often when we talk of fibromyalgia, people get confused whether it is a psychological disease or whether it is what is the type of the disease and what is the pattern of the disease. So I also heard that the fibromyalgia is not a one type of disease. We have different varieties with reference to fibromyalgia. Can you just elaborate on that?
Yes, sir. As you rightly said, the fibromyalgia patient blood test usually comes as normal. Only the patient feels pain and tenderness. But others, physician or relatives usually think that it doesn't have any disease as such. So usually there are three types of fibromyalgia. One is with sleep disturbances, second one is without sleep disturbances, and another type is fibromyalgia with psychological disease. So the most common psychological disease in these patients are anxiety and depression, which is seen about in 50% of the cases.
So that means to say that quite a good number of the patients have a psychiatric disorder, or should we really classify it as a psychiatric disorder?
We should not really classify it as a psychiatric disorder as such. They usually have a minor symptoms such as anxiety and depression, about 30 to 50%. So that can be managed with the available therapies and non-pharmaceutical intervention. So should not call it as a psychological disorder.
Rajeshwari, I think you had spoken in one of our patient education program about the psychology and its relationship with the pain. So do you attribute in these kind of patients that it's always the psychology which is responsible for the disease, or is there still something more in this particular case?
It is not. First of all, fibromyalgia is not something which cause psychological distress, because when we talk about pain, we usually there are two components, which is physical pain and psychological pain. So in fibromyalgia, it might be because of the physical pain, or it might be because of only psychological distress, which in turn causes the pain. So what happens usually when a person is stressed, or he is going through any kind of depression or panic attacks, a muscle gets stiff. That is when we get muscle pain, especially in our neck region or the shoulder region. So it is different from the joint pain. So when patients come to us, we educate them what exactly fibromyalgia is, what has to be done, and what not to be done, and what are the exercises, that is some of the muscle relaxation that can help them to relax the pain.
So I think some of them rightfully call this as an adaptive syndrome or a syndrome with a maladaptations. So, what's your opinion with regards to this?
Actually, it is an adaptive disorder. Usually, normally we have a pain threshold. Means for every pain or a stimulus, painful stimulus, people usually have certain threshold behind which they perceive it's a pain stimulus. In fibromyalgia patients, they usually have a low threshold, meaning that even the non-painful stimuli will be perceived as a pain in their mind. So it is basically because of the certain chemical changes which occurs in their brain and the spinal cord, due to which the threshold of the pain will be reduced. So they will usually complaining of this pain all over the body, and also associated with, as I said previously, the sleep disturbances such as early waking up and light sleeper, unfreshened sleep, usually in the early morning. So this is basically an adaptive disease rather than a psychological disorder.
So, is it something like, for instance, a person who works with a heavy labor or a heavy physical activity, he can tolerate the pain much better than a person who has a light working? I think probably if we compare the way a person who works in has a porter help in railway station who carry literally 10-15 suitcases a day, and I think sometimes even if you pull one suitcase, we start getting the pain. Is that something relatable to this, or what exactly is that?
Yeah, again, there's something more relatable to this, because those patients will have a more pain threshold level compared to the non-manual workers. And also we see in rheumatoid arthritis, where the farmers or labor workers, usually they don't complain of a joint pain much when compared to those who does not do a mechanical work. We call arthritis robusticus. You can similarly correlate with this with fibromyalgia.
So, does that mean, Rajeshwari, that a good physical exercises should help a patient with fibromyalgia?
Yeah, definitely. Because yes, when a person is diagnosed with fibromyalgia or any kind of bodily related pain, what they do is they stop doing any kind of work because they think it will increase the pain. That is where they go wrong. Initially, it might be difficult for them to cope up with the exercises or any kind of muscle relaxation exercise. The pain intensity might be more for a given point of a time, but it will help them in a long run. So exercise is really helpful in fibromyalgia patients.
So one of the lifestyle we suggest or we recommend is to become more physically active.
Yeah.
And I think, see, quite often I see the patients with fibromyalgia, if you tell them to do a physical activity, they start telling us, no doc, if I do a little work it will be painful, you are expecting me to do more physical activity. How exactly it's going to help? Can you just explain for the comfort of the patients that how it is not harmful and how does it really help?
So one thing what we always say is have a balance. Just because your doctor says do some physical activities, it is not like you join a gym and do like for 1 hour workouts, or you go for a walk for 1 hour, 1.5 hours, because obviously you have pain and your body is sensitive to pain, so you should know what is your body limit. So they can't do normal works where normal people do. So that limitation should be there. So and you have to take it slow. It is not like at a time you do everything. So the process is slow. So do regularly have a good like 10 to 15 minutes of walk daily, morning or evening, at least not twice a day, make it once a day. Instead of stopping it completely, it is better to walk for once. So that is how we suggest, go slow.
So I mean, I think sometimes it is called as a hen or an egg. So you have to come out of one of that.
Yeah.
So I think that basically one as you suggested, it's always best to go slow, but not to go at all. So the major problem is that they have an inhibition with the fear that the physical activity is going to worsen my pain. I mean, I actually see the concept what we have, especially in the general public, is if we have a pain, rest is the answer. Is that the correct one? What's your opinion, Praveen?
No, sir. In this case, I think rest is not the answer. Rest will again make them more depressed, and again it will exacerbate these symptoms. So mild to moderate activity should be encouraged in these patients. In fact, any arthritis patients or any of our patients, we still advise them to do a mild to moderate intensity of activity, which will keep them active, and it may also increases the pain threshold level by bringing up some chemical changes in the brain. So I always advise this patient to do a mild to moderate activity.
I think it looks is conceptually confused between the pain caused by an injury versus pain caused by a disease like this. I mean, no doubt if the pain is caused by an injury, rest is the best answer because there is a damage and the damage has to heal. So if you keep on moving that particular part, it may tear more than what it is at that point of time. But I think we need to remember, I think we have previously told even in our conversation that in fibromyalgia or for that matter in rheumatoid arthritis, there is no injury or a damage. So I think that being the case, thinking of giving a rest may not be a meaningful, am I right?
Yes,
Right. So I mean, other thing what I was wondering is how do you approach, how do you manage these patients?
Usually there are two types of approaches. Usually one we advise a non-pharmaceutical management as a change in the lifestyle, and we do advise them for exercises and yoga, meditation. Along with that, we go for a pharmacological therapy depending upon the psychological feature which are associated or a sleep pattern. So there are usually 3 to 4 types of the drugs we usually advise them, such as pregabalin, tryptamol, and duloxetine, and we decide depending upon their symptoms. If they are antidepressant or depression-like symptoms, we prescribe with the antidepressant. If they have anxiety features, we will add anti-anxiolytic drugs. So it will take time to act with the combination of this for non-pharmacological and pharmacological therapy. You can achieve or you can overcome this condition. It's not a tough situation like a cancer or other disorder. Only we have to balance and discuss with our physician and also the psychiatrist to how to overcome this disease.
Do you need a psychiatrist help in everywhere, or you would like to have a psychologist or a counselor?
Yes, even psychologist would be better to give at least 2 to 3 settings of cognitive behavioral therapy. So that would be a suffice in these cases because they don't truly have the psychiatric disease. So 2 to 3 sessions of the CBT therapy will be more helpful.
So I think Rajeshwari, what's your concept? How exactly you administer this CBT or a cognitive behavioral
Yeah,
therapy?
CBT is something which is called as cognitive behavioral therapy. So usually when a patient comes with prolonged pain or a chronic pain, it will manifest into negative behavior because they have a negative thought thinking of okay, this is it, like it won't get cured or something serious might happen. One thing they don't know, they don't understand what fibromyalgia is. So if you know how to manage fibromyalgia, it is very easy to deal with that. So once you stop understanding it might be any kind of diagnosis. Once you get to know what your diagnosis is, it is easy, your journey with the diagnosis will be easy. So in CBT, along with the patient, we prefer the caretaker to be there because it is not only the patient who goes through, even the family members who are living with them should understand what the patient is going through. So the support, the family support or the social support, what we call, is very important, which makes the journey of the patient easy. So that is how we make them understand and what has to be done and what kind of exercise they have to do. These are the things we explain there. Usually within one setting or 2 settings they'll understand what the diagnosis is, but sometimes if along with the physical pain, if they have any kind of psychological distress or psychological issues, then it may take more than 3 to 4 settings.
It's basically you try to make them to understand what the pain is and what his or her pain is and how to work with the pain. I was just wondering that we talk of so much about the pain. I think Praveen never said about that we can use painkiller. What's your concept? Why you didn't tell about the painkillers?
Actually, using the painkiller usually will exacerbate the condition, like tramadol and opiate, which we commonly routinely use. Those conditions will alter the changes chemicals in the brain, and it will exacerbate the disease as such. And as we are initially, as we said, there is no injury or there is no inflammation in this disorder, so we discourage the use of the painkillers. So it's only basically changes in the transmission of the pain which is leading to the fibromyalgia. So with the medication we try to alter those changes, and correcting those one will definitely help the patient rather than giving the painkiller.
I think one of the fear most of these patients are worried is it's going to be a lifelong disease. Is it so?
No, it's a wrong thought. So it's not a lifelong disease. With these present therapies, you can overcome with overcome of the fibromyalgia. Even the rheumatoid or any autoimmune disease itself, even it is not a lifelong disease. Actually, with the medication, with the regular medication, you can come over with this disorder. So it's only a matter of the time and how you cope with your therapy and your counseling. So definitely therapy depends upon how you cope with your therapy. So it's not a lifelong disease.
Not a lifelong disease. So in a nutshell, it's fibromyalgia is not something which you have to be worried that it's going to be a lifelong disease. And I think, as you said, the more you worry, more the problem is going to be. So you need to break that bad cycle of worry, pain, worry, pain. I think that cycle we have to break somewhere. In that, probably the medications as well as cognitive behavioral therapy should help these patients. Any quick message to the patients who suffer from fibromyalgia?
I think understanding your diagnosis and accepting what you have is it will make your journey with the diagnosis very easy. I think once you understand, 50% of the problem will get solved. Don't listen to others, their experience might be different and your way of dealing with that or your experience with that diagnosis is different. So come to your doctor, whether it is a physical pain or psychological issues, there is solution. So approach your doctor and talk to them. So it will help you.
So from you.
Yes, I mean, as we know, this younger generation are being more stressed and the lifestyle has been changed. I advise them to follow a good healthy lifestyle and also eat in a healthy way and become more physically active. I think that will also prevent you getting this disease and also helps in managing this fibromyalgia.
So I think in nutshell, fibromyalgia is not really a psychiatric disorder. It's not a psychological disorder. It's a sort of a maladaptive syndrome where the individual is not able to cope up with the day-to-day pain, which otherwise he would have been very well handling it much before he developed the fibromyalgia. And it's not a long-term disease. It may need sometime 6 months to years of treatment, but definitely one can come over that and lead a near normal life. And it's not a life-threatening disease. But only thing is it threats the life of every day, which one can easily overcome. Thank you very much for being a part of this discussion. Thank you.